It's getting hot, hot, hot in here. Lots of hot deals.
Really? It must be it's April. It's getting hot. The virus is going to die, and we're going to spray it with Clorox.
Exactly. It's the April 29th edition of Health in 2.0. Sir, do you have your Clorox? Have you started drinking it yet? We're now taking medical advice from the Trumpster. Oh, there it goes. Down the hatch.
They haven't put Clorox in the water yet, but I think it's going to come
a lot
soon.
Worse.
Yeah, there's been a lot of insanity going on. There's a whole bunch of apparently there's a bunch of doctors, Trump-loving doctors in Bakersfield saying that they should open up. You don't need to wear a mask. And Pence went around the Mayo Clinic today, who didn't have the balls to not let him in because he wouldn't wear a mask.
Ooh.
Yeah, I'm not impressed with the kowtowing of those nice Minnesota people. Should have kicked him out. Oh well, they didn't. He's a fool.
He sure is. Speaking of fools, speaking of fools, what are you doing? Get your timer ready. Let's go. We've got to.
I have a mask. I'm ready to put it on.
Gossip. I don't need the mask. Remember, we've done this.
All right, you ready?
With the mask. That's how long we've been in quarantine.
Okay.
All right, here we go. You ready? And go. Particle Health raises a $12 million A round. What does this one do?
All right. So this is a kind of another sort of super redox. It's the idea is it can get access to your data anywhere. They're trying to set up a platform that you can plug into and get access to data anywhere. The health data anywhere using Fire and a bunch of other stuff. Fun fact, Troy Bannister, the CEO, was the Kim turn. He was the intern to my employee, Kim Kruger at Health 2.0.
Ooh.
Later, he went on to work for Startup Health. The only person who I think has worked for both organizations. Very smart guy. Came up with this idea with a 2 million seed earlier, and now it's got another 12 million. Sharp, watch this space. Hopefully, it's going to help that interoperability thing that we may have talked about on this show before happen.
Destined for greatness. All right, AliveCor and OMRON partnered together in a remote monitoring play in cardiovascular care. What is this all about?
Yeah, so OMRON's got the blood pressure cuff. AliveCor's got the thing on the phone and in the watch wrist that does your EKG for your heartbeat. What they've done is they put the EKG thing into the blood pressure cuff so you can measure them both at the same time, which is pretty clever because it makes it easier for all the people who've already bought OMRON devices to do that. And also, OMRON put some money in. So this is actually pretty good. AliveCor's having trouble getting out of its box. I hope this will improve their progress.
All right, magic mushrooms in the news here. Compass Pathways scores $80 million in a B round for their psilocybin therapy for treatment-resistant depression.
Bound to work. Because anytime that you get, magic mushroom, psilocybin put into the bloodstream, it makes you much better. No. So here's the deal. All these people now going after, the ketamine thing that J&J did. Marco Molwico, who's my old colleague, my old friend from J&J, is in this company as well. Basically, the idea is, can you make something that was natural and then patent it and make a fortune off it? We'll see.
All right. Optum reportedly acquiring AbleTo for $470 million. This is gossip.
So I have a great story about AbleTo. So,
tell us your story.
I actually think that I should get, so this is interesting. AbleTo is one of the biggest.
Wait a minute. Time out. I actually think that I should get. Was that blank that you just skipped over going to be a kickback?
Yes, I'll tell you.
Of course it is. Of course. Go on.
As they say in the Stranger Spider, I'll tell you why. I'll tell you why. Because
please your case.
What is AbleTo? AbleTo is it's a little bit online CBT automated stuff, and a little bit get you to therapists, and a little bit get you to psychiatrists. It had a big deal with Aetna in the early days, and grew up. Now, the very first time Aetna appeared on stage at Health 2.0, they had to go to the back of the line because their demo didn't work. And it was like, when there was one man and a dog running the company, the demo didn't work. This is 2011, 2012. And somewhere they finally made the demo work right at the end of the session. It's like 3 minutes to go. And the moderator goes back. So the folks at AbleTo, it was Michael Laskow was Michael Laskow was the guy CEO. Said, does the thing work, Mike? And he went, oh yes, it's up and running. But he had to go back and call his tech people and make it work. So he does the demo. In the very back of the room is somebody from Aetna who the week before had been in the meeting where someone said, oh, we need a new digital health, mental health thing. And that person called his mate at Aetna. The other guy at Aetna called Michael, and that was where AbleTo's very, very first deal came from. So,
So you want a cut of the deal by Optum?
absolutely.
Because you got them a deal at
$40 million or whatever. If that first thing had
what are you?
I settle for 1%. 4.8 million. I'm done. I'm happy. I don't have to send the
Oh, friends at AbleTo, send him something, a shirt, something, please.
Well, I mean, but seriously, it's an interesting thing because not only do you have like a little startup finally makes it after raising a bunch of money and what have you, and some CEO changes that, the then CEO Mike is not there anymore, but you also have a huge health plan, buying more stuff now, buying basically another provider group, a virtual online provider group to go with all the doctors it's been buying. So Optum is, putting the pieces together to become a big virtual Kaiser for United, and at some point that'll be the way it goes.
Yeah. Well, they're arming up for it.
The arms race continues, and they are the people with the most money and the most arms.
Indeed.
Well, I'm not sure they're the most arms. Optum, Octopus, something? No. Okay.
Just stop. Just stop while you're ahead.
Stop.
All right. So if you want your digital health hopes and dreams to come true, all roads lead to that guy, Bolty Boy. So at Bolty Boy, follow him on Twitter. I am at Jess DeMassa, making no promises, taking no cuts. Unlike him. And you can follow along with our lovely little show here on the healthcare blog, along with all the other great COVID-19 coverage that has been, covering every aspect of this whole pandemic. Truly doing a lot of great stuff over there. So sign up for our email newsletter on thehealthcareblog.com. Sir.
Thank you, Mr. Massa. I would like to quick plug. Please
Yes.
watch the THCB Gang every Thursday at 1 p.m. Pacific, 4 p.m. Eastern, available as a podcast. And of course, these shows, which is why you're now saying the date at the start, these Health in 2.0 shows, also available as a podcast on your favorite podcast channel, so long as it's iTunes or Spotify.
Well done.
Look at me promoting away.
I know, right? Good for you. Good job. All right. Well, thanks for joining us, guys. We'll talk to you soon. Thanks.